Hi, this is a continuation of our discussion on scrotal pain. We will continue with the history. The physician will want to know if there are any predisposing factors or trauma. The physician will want to know if there has been a penile discharge, pain on urination, again trauma to the scrotum, any overseas travel, has there been a lump in the scrotum or groin area, any pain in areas besides the scrotum, such as the back. During the physical exam, the physician will examine both sides of the scrotum, while the patient is standing and lying down with the face pointing upward. The physician will start with an inspection of the skin, then proceed with inspection and palpation of the inguinal and femoral canal openings. An inguinal hernia involves a portion of intestine bulging into or through the inguinal canal. A femoral hernia involves a portion of intestine bulging through the femoral canal, which houses the femoral artery as it runs from the abdomen to the groin and upper thigh. The physician will inspect the spermatic cord. The spermatic cord is the cord-like structure in males that runs from the deep inguinal ring down to each testicle. The physician will then examine the testicles. A testicle is the male reproductive gland. It functions to produce both sperm and androgens, primarily testosterone. And the physician will also examine the epididymis. This is a coiled tube at the back of the testicle. It stores and carries sperm. The physician will gently elevate the testicles. The physical lifting of the testicles usually relieves the pain of epididymitis, an inflammation of the epididymis, but not pain caused by testicular torsion. Now the physician will order testing that may help making a diagnosis, such as a full blood count, a urine analysis and culture, testing for chlamydia and gonorrhea, and an ultrasound. A scrotal ultrasound is a safe and painless test that uses sound waves to make images of the scrotum, again the pouch of skin at the base of the penis that contains the testicles. The physician might also order a technetium scan. A technetium scan is a radioisotope scan, and it reflects the vascular flow to the testicles. As a result, the scan shows a distinct cold pattern when arterial perfusion is compromised, and a hot pattern when blood supply to the organ is increased. This is the basis for use of the technetium scan to differentiate between testicular torsion and other conditions simulating it. But a radioisotope scan takes time that is usually not available if the patient is considering testicular torsion as the diagnosis. Epididymitis. Epididymitis is the inflammation of the epididymis and is usually caused by sexually transmitted pathogens in males under 30 and by urinary tract pathogens in males over 30. Although most men with acute epididymitis can be treated on an outpatient basis, referral to a specialist and hospitalization should be considered when severe pain or fever suggests other diagnoses, such as torsion, testicular infarctions, abscesses, and necrotizing fasciitis, or when men are unable to comply with an antimicrobial regime. Because high fever is uncommon, hospitalization should be considered. Testicular cancer. It can occur at all ages. They are more common in young men between the ages of 20 through 40. They can present with pain. Most do not present initially with pain. Hematoceles, again, are collections of blood within the scrotal sac, but outside of the testicles. All hematoceles require surgery to determine if there is a testicular rupture or a tumor. Trauma to the scrotum may produce urethral injury and extravasation of urine into the scrotum. This requires surgery. Scrotal skin infections. Problems with the skin of the scrotum can be serious. The skin of the scrotum can have sebaceous cysts. A sebaceous cyst is a closed sac found under the skin, usually on the trunk, neck, or face. They are filled with cheese-like matter and usually are painless. But if they become infected, they will be painful. They will need to be incised and drained. Fournier's gangrene. Fournier's gangrene starts as a sudden skin infection of the scrotal skin. If the patient is not treated with antibiotic therapy quickly, then gangrene of the scrotal skin can occur. The scrotal skin will slough off and expose the testicles. This is an emergent condition. It is typically seen in elderly, diabetic, or otherwise immune-compromised individuals. Now, when to refer? Well, a suspected torsion of the testicle should be referred. Sudden scrotal pain should be referred. Recurrent testicular pain in a young male should be referred. A testicular lump with or without pain should be referred. The presentation of a hematocele surrounding a testicle requires referral. Severe scrotal skin infections require referral. Now, referral time must always be considered as important, particularly the 4-hour guideline for testicular torsion must always be considered. So, urgency is prime. Well, I think we'll end here. I hope this helps. Have a good day.